Sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health, heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and where we do encourage you to call in to join in. Today, well, let me ask you this. Anybody out there having a chronic pain problem? Not just chronic. How about acute pain problem? How about you fell down yesterday? The pain's pretty intense today. What to do about it? You got to be asking the question, is there any relief possible, no matter what type of pain you're having? The answer is, you better believe it. It's all wrapped up in something we've been offering for a number of years now called The Matrix. And so, as I've revealed to you, it's about time that we unveil The Matrix to you in a way, well, we just have never done before. We're going to do so by bringing you two guests. We're going to be a three-way conversation. One gentleman, a manufacturer of, and the only device that is able to perform what we're going to be talking about today, this thing called a Matrix. His name is Mr. Peter Beltram. He's going to be coming to us at 5 o'clock in the morning from the West Coast. And the gentleman on the East Coast is a gentleman, Mike Ramazio, is a really multi-year clinician in the use of Matrix technology. Today, if you do have a pain problem, or if you have or know someone that has one and doesn't know what to do about it, hopefully we'll be able to give you some advice that you can pursue today to get that much sought-after relief that just seems to be avoiding you. So, talking about the Matrix today in its entirety. Look, if in the course of our discussion with our two guests, you want to call in to ask a question and make a comment, that number, of course, as always, will be 412-825-6262. That's 412-825-6262. Pain problems and the correction thereof, our topic for today. Now, I hope you paid attention on Monday when we had the girls from Three Rivers Thermography with us on that day. I think we've pretty much delved into the issue of the breast cancer awareness topic in pretty negative terms initially at the beginning of the month, and I hope that we ended on a positive note on Monday, describing for you ladies out there probably how best to breast cancer assess and know that if you had a negative study that you're pretty much out of the woods. You don't have to worry about it. If you have a negative mammogram, I don't think that you can just completely scratch that off as now done for year 2010. The number, if you wanted to schedule an appointment, if you want to talk to the girls, I'm going to give you their number once again, 412-548-3612. That's at their office right out there in Allison Park, Babcock Boulevard area of the city. But they do travel around. They do come here. They go to a number of other offices. You'd probably be best to check with them. If you wanted to come into our office, because they're due in here twice this month, the number to do that is 724-942-3002. We'll schedule you to be seen to get a thermogram on the 2 days that they're coming here. And if you are interested in finding if there's some other place that's a little closer to you, use that 412-548-3612 directly to their offices. They'll be able to advise you as to where these studies are given, and if it's in your backyard, so be it. If you got to travel a little bit, hey, come on in to see us. We'd certainly like to meet you. Now, the rest of the month is shaping up too. We're going to be hitting the issue of pain and the relief thereof today through a technology called Matrix. Now, we're going to pick up with that ball on Friday and take it to another level. A colleague of mine, at least a co-professional, one I really had never met before, but I've talked to on the phone. He is an anesthesiologist from Akron, Ohio. His name is Dr. Frank Crusay. He works and runs the anesthesia department of a outpatient surgery facility in that area. And he's unique to the extent that he uses regional anesthesia. That's a buzzword for nerve blocks, needle-delivered nerve blocks. And then after delivering a nerve block so the surgery can take place in the operating room, he then walks out into the pain clinic, which he has at the same facility, and utilizes this matrix technology and not the nerve block on them. So with that being said, I hope that you can appreciate both today's topic and a similar topic from a different perspective on Friday when Dr. Frank Crusay comes aboard with us for that 1 hour discussion of the clinical side. We'll compare notes. I've got a set of notes for many, many years that I can rely on, and I'd like to see if he's getting similar results. I think you would enjoy the interplay between Dr. Frank Crusay and myself. The next week, finally got some information on Bill Henderson. Evidently, the gentleman has well written 3 different books he's written on the subject of cancer healing. His most recent one, entitled Cancer Free, Your Guide to Gentle, Non-Toxic Healing, is the most recent offering, and of course one he'll probably be featuring when he is up at the Freedom of Choice in Cancer Therapy group on the 21st, which is next Thursday. Well, we usually, if we can arrange it, try to bring that same speaker to our airways within that week, and Bill will be with us on Monday to talk about a subject of non-conventional cancer therapy, non-toxic, probably best described by his title, Your Guide to Gentle, Non-Toxic Healing when it comes to cancer. And the gentleman will, his credentials are pretty impeccable. We'll get to them as the month marches on. Now, in the last few days, we've sort of rounded out the months to make it action-packed all the way up to the final week of October. On the 25th, Cass Ingram's coming back. You all know Cass, who was just here last month in Pittsburgh, described as the most energetic healing person ever witnessed by most of you who did go up to see him at the Freedom of Choice in Cancer Therapy group. We've had Cass on our show many times before. Tough to get him. He's usually in the woods, if you know what I mean. His most recent book being The Cure is in the Forest. And right now, he's not, well, he might be in the forest, but he's in England. And I'm not too familiar with the vast forest lands in that country. There might be. But for sure, he's going to be calling us on the Monday, the 25th. We're going to continue to talk about more cures from the forest. And just inked yesterday and brought to the forefront with respect to the 27th, which is going to be on a Wednesday. Mark Underwood's coming back. Now, he's a gentleman who invented a unique product called Prevagen based on jellyfish and used for memory issues. His topic, are you suffering from CRS? What's CRS, you say? Well, Mark calls it can't remember stuff. That's a pretty good way of describing it. You having trouble remembering stuff? Well, you want to be with us on the 27th when we bring Mark Underwood to you to round out our month, and it's been jam-packed this month with topics and guests and the like, and we like to keep it fast-paced and hope you strap it on board and come along with us each and every time that we go to the airways. Okay, let's do this. I'm going to take a short break, and in the interim, start to round up our guests for today. One's in Atlanta, one's on the West Coast. We'll see if we can hook this all up in the next minute or two. You enjoy these commercial messages. We'll be back in a moment and talking to you about how to get rid of pain that you can't seem to get any relief from. Something called the Matrix. Listen with us today. We'll be right back. See you in a moment.
This is Dennis J. Courtney, MD. You've become confused about how best to manage your health. It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instructions, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Have you been to the doctor lately? Was fatigue top of your complaint list? Even if your doctor asks you what you eat, the recommended 5 servings of fruits and vegetables a day isn't free in your busy schedule. What if you learned of a product 5 years in formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Fruit of the Spirit. The blessings of Fruit of the Spirit are now formulated into a delicious whole fruit array of products rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith. Let Fruit of the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
Hey, good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here on KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Wednesday version of the show, and as advertised, how about the question I posed to you when we first took to the airways today? Do you have pain? Do you have a pain problem, whether it's acute or chronic? Are you looking for some relief of that pain? Well, something you may not ever have thought of before is a unique way of being able to do just that. We put it under a rubric called the Matrix. You need to find out what this Matrix is all about and how, in fact, it may well provide you with the relief that you are seeking. We're going to have 2 experts with us today, all coming from different aspects of this same Matrix rubric. One from the West Coast, a manufacturer of the product. One from the East Coast, a clinician involved with this product for quite a few years. The gentleman, we're going to find out. I know I have Mike Gramazio with me. Mike, you're still there, right?
I am, good morning.
Okay, by the way, Mike, when you speak, you're going to have to speak up a little louder. I can tell right now there's quite a drop-off between you and me.
Oh.
You don't have to be a loudmouth like I do, but you do have to pick up the volume a bit. Let me check while we're doing that with the other side of the country. Peter Beltram, are you with us, too?
Yes, I am.
Okay, now, Pete, you're sounding nice and loud. Mike, let's do it one more time. Hello, Mike, you there?
Is that good?
There you go. Both of you now are with us alive, well, and kicking. Now, it's unique, ladies and gentlemen. These 2 people I've known, both of them, for a number of years. In fact, when we first brought Matrix to our office, Mike Gramazio was our instructor. He's the one that came and gave us our initial introduction and how to use Matrix, and we've been using it ever since. Well, Mike's continued on doing what he's always done, teaching others and utilizing the device that Peter actually makes now. And so I thought that a good first show on this Matrix would do us real well if we talk to these 2 individuals from their perspective of instructor and manufacturer. And so we're going to do just that. Now, gentlemen, let's let our listeners get a little accustomed to you and allow you to tell us a bit about your background. Let's take you first, Dr. Mike Gramazio. By the way, you're a naturopath, so you get a naturopathic degree. You also have a doctorate in electrophysiology, so your credentials are pretty potent with respect to our listeners, I'm sure. Tell us a bit about your trek, Mike, in terms of how you have arrived to this point in your life and have been supportive of this device called a Matrix machine for so long. Take it away for a moment.
Okay, thank you.
I have an interesting background. I actually started as an electrician, construction industry, after the short bout of 3 years in the Army. And I'm a graduate in 1983 of a naturopathic college out of Colorado that came to Florida. And I pursued that direction, and I was approached by a gentleman that was a partner of mine in a venture, and he said, "Could you help me with this new company, Nemectron?" Now, there's another name there. The Matrix is actually a child of the Nemectron. Hans Nemec was a physicist from Austria who surmised that everything was unsafe in electrotherapy, and he invented the first alternating current, 4,000 cycles per second machine called E-stent, electric stimulation, in the world. They were number one in the world, and they wanted the FDA approval. And we were lucky enough, late 80s, I think it's 1988, that we were approached to bring that machine into the FDA, shall I say, approval.
Into the United States.
I'm sorry?
Into the United States. Evidently, it was used in Europe, huh?
They were number one, not just in Europe, but in the world. As a matter of fact, in the '88 World Games in Korea, they were the only machine allowed for the players.
For the athletes.
Athletes in Germany, it's the only electrotherapy allowed for the Army. They were famous within the world, but never managed or cared to come to the States. They finally did.
In 1988. And you say it sought and did receive the FDA approval at that time?
Absolutely, yes.
And you were involved with this from its inception, huh?
Yes, from its inception in the country, the United States. And it was an eye-opener as a naturopathic physician with a medical degree, academia only. I decided that there's something to this, and I had to pursue it. And I used it on myself and my family and people that came to our clinic, and it was amazing, absolutely amazing. That started my teaching career.
And it sure did. So from '88 to present, because it's an interesting side note. When I was talking to Peter, he said, "Well, I got a gentleman I'd like to bring on board with us when we do the show. His name is Mike Gramazio," and I about fell off my chair. I go, "Well, I know Mike. Goodness, he was our first instructor." So what you did for myself and my staff is what you've been doing for many individuals, many docs and their staffs for 20 years now, 20 years plus.
22 years. The interesting thing is I was asked by another friend of 19 years, partner, to work in his clinic in Atlanta. And I've been there as a clinician for 11 years now.
For 11 of those 22.
And I use the exact same machine now.
All right. I think that this speaks of a pretty interesting background. And I always like to hear when someone's involved from the initial point where they could, brought to the United States. I didn't expect you to be in Europe. So from the moment it was brought here, you've been involved with it, and you continue to be involved with it today. You have the same amount of passion today that I identified in you when it was about 8 years ago. I think it's around 8. Didn't we figure that out? About 8 years since you brought that training to us, and we've been using the device ever since too. About 8. All right, now let's turn our attention a bit to someone that may not have been involved from its inception, meaning 1988's inception, but certainly is well involved and well entrenched in this Matrix device today. His name is Mr. Peter Beltram. He is the president and CEO of a company called Neuromet, the unique manufacturer of this Matrix device. Peter, you there?
Yes, I am.
Why don't you take a moment or two and give us your unique background that brings you and brings us all up to speed today in terms of your involvement with this Matrix device, and that the level that you're now at. I always identified you in my thought process as the single most important person in promoting Matrix throughout the country. Whenever I had a question, I called you. You always seem to have an answer. Give me some reasoning and my listeners some reasoning. Why did you always have the answer, Peter?
Well, interestingly enough, I actually started with the company Nemectron when we brought that technology into the United States also.
You were there too?
I was here also. As a matter of fact, we were actually based out of Southern California, which I still live in here in Southern California myself. So from the very beginning, when the technology was first brought in, I considered it to be the same as every therapy machine in the marketplace. Very similar to an interferential unit or a TENS unit, which most of the population, especially physicians, think of this as being like a TENS unit, which I did the same thing also.
Yeah, we're going to get into that because we need to. I'm pretty sure there is some confusion about TENS versus matrix and interferential. So we'll clear that up. But I'm very much intrigued now because I've never really gotten into your background before. So you were there at the beginning, and were you using it as a clinician at the time too, or what is your background that made you so interested in pain work?
No, as a matter of fact, my background was primarily in sales and marketing. So I actually became one of the regional managers for the company Nemetron in the United States.
Okay.
Exactly. So unfortunately, back in the early 90s, when the German mark was very high compared to the American dollar, Nemetron actually had to close their U.S. distribution, so they were no longer able to sell the product. So at that point in time, we basically, some of the salespeople, we all got together, and that's where the company name Matrix came from. We basically started buying equipment directly from Nemetron, importing it, and distributing that technology to the physicians here in the United States.
So they were still being made in Europe at the time?
At the time, they were still manufactured for us. The reason for the passion that I have always extended throughout my 22 years experience has been that the results that the technology has brought, that the patient who had severe 10-level pain, when the doctor applied this type of technology on them, they walked out with 50% less pain on one treatment alone. And that changed a lot of people's thinking of the technology, number one, but number two, the patient's lifestyle, the quality of life. I felt that basically I was on the cutting edge of something unique that we felt we didn't want to lose. So that's the reason why the Matrix really came around from the pretty much from 1994 is when we actually got our clearance by the FDA for the Matrix, and then until 2002, and that's when I basically formed the company known as from Nemetron to Matrix, now to Neuromed.
And so now the device is manufactured right on here in the United States instead of being manufactured in Europe, I take it, right?
Actually, it's still German engineering, and we actually manufacture and assemble in Canada now.
You assemble in Canada. Were those raw products made still in Germany?
Still in Germany, yeah.
Oh, okay. So they still manufacture the components. You just assemble them in Canada, and then somebody puts them in a truck and drives them over the border, huh?
No, actually flies them in.
Flies them in. Okay, and you've been involved at that level with this company called Neuromed since, I think I heard you say, 2002, correct?
That's correct.
All right. Folks, there you have it. There are the backgrounds of two unique gentlemen. And surprisingly enough, both were involved since the late 1980s with the device under its original name, Metron, and now here we are with Matrix. So let's move down a little bit of a discussion for listeners who, interesting as your backgrounds may be, their current situation is they have a painful problem. So let's start sifting through educating our listeners to be able to appreciate these electronic devices that are out there, and there are many of them out there, and how to distinguish one from another. I guess we've got to start with, let's use the term matrix. From each of your perspectives, I'll start with you, Mike. What is a matrix? What makes matrix so special?
The best comment that I can actually keep from my patients in the last 11 years is that it's comfortable, never painful, and they always feel a percentage. So everyone perceives it differently. Everybody's pain level, one person will come in with a 5, and someone will come with a 9, and they're both exactly the same situation. So the perception is different. However, everyone that I've had in the clinic and in the training in the last 20-some odd years is that it's always comfortable. People that are even paranoid of electricity for specific chemical reasons still do not complain about the feeling. It's almost like it's more forgiving than the average electric stimulation, and it has a comfort level that even if you turn it up high enough, do a neuron blockade, if I may say that, it's still very, very comfortable.
All right, so
and it's very safe.
So you answer this from a clinician's perspective on, you call Matrix one of the best ways you've ever seen, I'm gathering, to alleviate pain, and just about everyone that comes to you gets some degree of alleviation. Now, Peter, if I were to ask you, what's the Matrix or what makes it so special, how would you answer that question?
Well, interestingly enough, when we have physicians or even insurance companies that we work with or talk to, and they ask the same question, what is the Matrix? The first thing that comes to their mind is it was a great movie, several years ago. But other than that, actually, the Matrix is actually was a manufacturer of the technology. The actual technology itself, or what we're referring to with this type of energy that we're providing a patient delivered by a machine, is really called electroanalgesia.
Ah, okay.
So electroanalgesia, what that really is, that makes it very unique, it's using extremely high pulses per second, or in Germany we call it hertz. We call it frequencies. So the terminology really refers to very fast pulses.
And these, in terms of the devices that are out there, because as I say once again, there are many.
Yep.
These are the highest pulse rates allowable. Would that be fair to say?
It is. As a matter of fact, we actually got a clearance by the FDA to go to as high as 10,000 pulses per second. Most of the devices in the marketplace, to keep it very simple, especially for the listening audience, is that most of the technologies that are out there use between 1 to 250 pulses per second.
Oh, that's way on. There's quite a difference there.
Very, very low. So they're very good, very important to utilize those low pulses also, depending on what type of condition the patients are coming in with. The reason why we use such a high frequency or such a high pulse is that when there is severe pain, and that's pretty much why every doctor uses this technology, is when there is severe pain, they would like to be able to inhibit, be able to stop those pain signals from firing. And the way we do that is we found out by microcell biology textbooks and also physics professor being able to publish some books for us. They came back and said it's the higher pulses that will cause that analgesia, and that's where the terminology really comes from. Being able to deliver high pulses at high amount of energy to be able to anesthetize an area. So,
and boy, these are words that are buzzwords for me. So, would it be safe to say then that it's the ability you use the word, you said inhibit, meaning not to allow a pain impulse to even be generated. Am I interpreting the word inhibit in the context that you mean it?
Yes.
So I've never heard this explanation before. You actually can prevent a pain impulse from even being generated, as opposed to modulating or diminishing or decreasing the intensity of a pain impulse that has already been generated, which is quite a bit of difference of an approach. Absolutely different. Fair enough. Fair enough said. Mike Gramazzo, you've been listening to this. Does this match up to what you've have come to know, and as an electrophysiologist, does the description by Mr. Beltram equal your description of this ability to inhibit, which I think is a great word I had never heard before used with respect to this device?
Absolutely. I completely agree with that. There are technical terms that explain that in the textbooks.
And we don't need to get into it because it's really complicated. I'd like keeping it simple, and I think you've made it simple to me. I'm going to use that word inhibit rather than attenuate, and from this point forward, because I really didn't know that it had that possibility and capability of doing so. How about this? I speak of this device a lot, and the usual response I get is, oh, that's a TENS unit. I've done a TENS unit. TENS units really don't help me. They give me some minimal relief. And so could you help, the two of you, help clear up this confusion that exists between what a TENS unit is and what the Matrix device is, because they are very much different, wouldn't you say? Let's take your perspective, Peter. How about you? Well, how do you answer that question? It's got to come up in your discussions with other clinicians.
Absolutely. That's one of the main things when we start talking with a lot of the doctors about this technology. That's the first thing that comes to their mind is, oh, this is a typical TENS unit, because when you mention the word electrical energy or electrical stimulation, it goes to that mindset. The reason behind it is because when the doctors go through their education itself, they do talk about different pain mechanisms of action and different ways of treating pain, and one of them definitely comes up is a TENS. TENS actually stands for transcutaneous electrical nerve stimulation.
Yes.
Having said that, the TENS technology, which most of the patients take home with them or a doctor prescribed, actually came out in 1965. There was an article actually written by two physicians, Melvek and Wall.
The Canadians. Oh, yeah, famous guys.
Absolutely. And they pretty much came out with the gate control theory of pain. That was basically in 1965. So since 1965, that's always been the mindset of being able to utilize a TENS unit. So TENS unit, we refer to is the ability to be able to stimulate the nerves by using low pulses. And remember how we talked about between 1 to 250?
Okay.
That's where that technology falls into. So does it work? Yes, it does work, because it does cause counter-irritation. The Matrix technology that we refer to really is utilizing software algorithms that we basically utilize TENS technology. We do put that in there because there's times that you do need those pulses, but we also incorporate electroanalgesia in there also. In other words, we use those high frequencies that we spoke about to be able to anesthetize or to inhibit that pain signal.
Anesthetize. Once again, inhibit and anesthetize. Two key words that are possible with the Matrix that are not possible with the TENS?
They're possible with the TENS by means of a counter-irritation.
Okay, just a different mechanism. You inhibit, they bend and change and so on and contort, and through that contortion, they can get a similar result just with a different mechanism, huh?
Different mechanism, and the way that we refer to it as a manufacturer or as sales in the territory is that they're able to stimulate or they're able to facilitate. So low pulses are able to stimulate, faster pulses are able to facilitate. And what that really means too is excite or fatigue.
Fatigue. And thereby, through fatiguing that impulse, you inhibit it and you anesthetize. That keyword, anesthetize, I love it. Remember, I am an anesthesiologist, so I always like that word. Mike, back to you. I'm sure, Peter is working with potential buyers of his machinery. He is the CEO of a company that makes it. But you're out there for 11 years now working with patients every single day. Do you find that confusion between TENS units and the like? And if you do, how do you assess it and how do you combat it?
Well, actually, it happens to me every single day.
Every day, okay.
I have people that are completely paranoid of any electrical stimulation, even the ones that are not battery operated and are not portable TENS units. A lot of the machines out there are electrical TENS units. They irritate the surface nerve that fuse the brain and shut down the connection, and that's where that Melvek and Walsh came into. But that's the same as when you bang your elbow, you rub it. That's all the TENS unit is doing, and that's all the electric stimulation.
Oh, good way of putting it.
Doing socially, using the receptors on the surface. So it's really not facilitating. Peter said it's stimulating and it's aggravating, and you get endorphins and Teslas and all kinds of pain coming out of the brain. You say, I got to fix that. Well, the difference is when I explain to these people that it is not only comfortable and completely safe for the entire body, it is forgiving, and it works on a much higher level than the body can actually perceive, and that's how it facilitates the changing of the message by literally stopping the message by making it go too fast.
Stop the message. Inhibit. Anesthetize. Key words. I keep hearing them come up over and over again. They certainly match up to what I see happen in every patient that we put on the device, which probably now is a good place to go next. And I'll come back to you, Mike, because you're the guy working every day in the trenches, sort of like I am in the trenches every day. You're dealing with patients who have pain problems every single day. Let's walk through and let me fire at you some questions that are pertinent that I have to answer every day, and I'm sure you do too. How about this? With respect to the cause of the pain, it is, well, I'll ask, is it important that the etiology of that pain, or does it not matter what the cause may be, because the impulse is an impulse? Pain is this noxious stimulus, and these machines have the ability to contend with the impulse no matter what generates it. How about that?
The answer actually, fortunately and unfortunately, is both correct. What happens is, yes, it will stop pain regardless of the cause. It's called etiology. However, you still have to address that. So you have to address what's causing this pain, and in the interim, stop the pain and stop the brain from sending this message. Removing the inflammation, one of the things that it does, because of its the waveform, and the 4 to 10,000 cycles per second, by the way, is alternating current, and it's locked into a waveform that is pure. It's called a sine wave, and it doesn't change. That's the key between this equipment and any other equipment out there. It never changes no matter you take the pads on and off the person, and you can move them around. It hurts there. Oh, it feels good. You're always moving inflammation out of the area, stopping that message by making it too fast, and allowing the body to calm that area down instead of just throwing more chemicals. But as far as the cause is concerned, regardless of the cause, you can get relief, but you still have to address the cause.
I think that you started your answer very appropriately. You said there's good and there's bad here, and really, you should never be dissuaded from the quest of identifying what the cause is. But we got so many people who come to us after years of agony. No one's ever been able to give them the appropriate diagnosis. It's now 5 or 10 years after the fact. They would like to sleep with this device. I mean, they find a friend, whereas they never had found one before, because the cause has been pretty much extremely elusive, to say the least, in their case.
It's been ignored and blocked, and when you block receptor sites that send messages, you're also blocking the body's innate ability to repair itself.
So you would say, by blocking, that's pharmaceutical, huh? If you use a pharmaceutical preparation, you occupy the pain receptor site, you block that pain receptor site. Is that what you mean by saying that that's not a good thing?
It's really not a good thing in the long run, because I want you to visualize, I want your listeners to visualize it. And medication actually drives a wedge in these receptor sites, little openings, microscopic openings, that are trying to send this message. They're firing too slow or too fast. That's not good, because now you've stopped something from doing its natural job. What we do, because of what we call, we give this sustained polarization, we stop the message because of the high frequency, and it actually freezes those receptor sites open naturally, lets them rest, gets the inflammation out of the area, calms the brain down, and then once they start firing again, it really has called a neuromuscular re-education. Those receptor sites that are overfiring now calm down and fire normal. So it's normalization of cell function instead of stopping.
All right, that's a great.
That's technical, is that right?
Well, that was as much technical as needed to make the point. I'm fully understanding. I hope my listeners are too. Let's take some more practical questions. Still at you, Mike, because you're applying this every day. How long does the treatment take? People want to know.
Okay, the average treatment that's programmed is 15 to 20 minutes.
Not very long at all, Mike.
No.
You think about the benefit here. Okay, let's ask this next question. What is the percentage of responders? In other words, for every 100 people that come in and seek relief, would, in your experience, do all 100 get some degree of relief, or is there a percentage that doesn't? And if so, what percentages do you see that don't reliably get the kind of pain relief that you're seeking? And is it a matter of maybe initial treatment versus second versus third. How do you answer that question? Because it's got to be asked of you every day.
Everyone asks that question, and my answer immediately is you will get a small percentage, 10 to 15%, the very first treatment. Sometimes, unfortunately, I get it, the pain is gone. And I say unfortunately because they don't really address the reason. I feel great, steer. And what happens there is that another type of mentality. I tell everybody from 6 to 10 treatments. I want you to expect that, whether it's 3 times a week or 2 times a week or whatever. It's called stacking. And I tell them right up front, when you start this program, please allow enough time, 15 to 20 minutes, twice a week, for you to feel better and have a sense of well-being that we're not invading the body. It's non-invasive. It's normal, how shall I put it, waveforms that your body accepts because it's almost exactly how you would read the body to put it on a machine. And I tell them, don't expect immediate results of 80 or 90%. However, after the 6 to 10 treatments, the numbers are out there. They've always been out there. The original studies, 74 to 80, 85 or 86% complete relief.
74 to 85% get 100% pain relief after about 6 treatments.
Yeah, 6 to 10 treatments.
Excellent.
And if you address the circumstances, we do a lot of other modalities along with that. We have natural creams that we send them home with. We have certain exercises, as an example. And now with the relief, the muscle is not spasming. The nerves aren't overfiring. They're able to do their little stretches and their minor exercises. It's all part of the routine for getting back into life. Supporting the lumbar with a pillow if you're sitting all day. Little things like that. And we're always in the form of teaching. And that's why I kept my nonprofit, ACE Institute, Advanced Clinical Electrophysiology, is the nonprofit that I've kept alive on purpose so that I could teach the public and teach, physicians and clinicians. And just that's my passion, is really teaching. Because when I treat a patient, I'm actually teaching.
Well, Mike, some great things here. Let's move over to the manufacturing side. Hey, does this make sense to you as a manufacturer? One that puts materials together, has to go out and meet groups who had never heard of the term matrix before. Is what Mike mentioned consistent with what you find in the research that backs up and allows you to make the educational materials that you make about your device?
Absolutely. As a matter of fact, when we go out and talk to the physicians, we usually encourage for the doctor to try out the technology on 5 of their worst low back pain patients they have. We pretty much put the challenge to the doctor and to the patients. And what we do is we bring the technology in, and we pretty much say that 4 out of 5 are going to walk out with 50% less pain on one treatment.
On the first treatment.
On first treatment alone. So having said that, one of the main things that we tell a lot of doctors once they actually have the technology in their practice is let them know that we're not going to get 100% success on every patient. We'd love to. We'd love to be able to put our stamp of approval for that, but that's not going to happen. So typically, doctors, we tell them to evaluate the patient after every 3 to 5 sessions of treatment. Because if after 3 to 5 sessions, if the pain relief has not dropped significant, analgesic duration, meaning how much pain relief they've had, has been going longer and longer and longer, the patient's quality of life and also the range of motion. If we don't see those changes at all occurring within 3 to 5, this technology is not going to work.
And what percentage, okay, that's fair. Nothing's 100%. What percentage do you think of the total would represent that fraction? Was that 5%? Is it 7%? What percentage of people just won't experience success with this device, and we should tell people that?
Typically, they'll see results fairly quickly. In a lot, it's more of it's breaking the cycle, because if there's a structural element, if there's a bulge disc or bone on bone, those type of candidates are not going to get pain relief. They'll get a little bit of pain relief, but it's not going to be long-term pain relief. So percentage-wise, we're looking at outcome. So when we say that is more after 3 to 5 sessions, if there's not a component of something structural on those patients, bulge disc or bone on bone, they're going to get very high success. In those, I would probably say that you're looking at 15 to 20% are not going to respond, but other percentage of people will respond very positive.
And it makes sense that if, and maybe I'll uncover a little bit of the stealthiness of what you just said, if there is a impingement problem on nerve that hasn't been identified, you can't expect to have any device alleviate that form of pain. It's going to have to be a surgical intervention first, for sure, and it just hadn't passed scrutiny yet, hadn't been identified. That is something that makes complete sense to me. I hope by interjecting in at this point, it makes sense to listeners as to why this thing isn't 100%. Well, maybe you've got a problem that needs to be yet diagnosed that might require some intervention in order to allow the matrix to actually do what it could do for you. And I'll let it go with that. Fair enough, guys? Okay. By the way, you'll take calls, won't you?
Absolutely.
I thought I heard a knock on the door. Let's see if they're still there. Come on, the store. You're with Peter and Michael. Go right ahead. Hello?
Hi, Dr. Courtney.
Yes.
Can either of your doctors be contacted in the office?
In their offices?
Yes.
Well, I think, Peter, you certainly take calls.
Absolutely. We don't really take calls when it comes to, diagnosing or protocols, because that's more of we basically are manufacturers of devices. But if it's more of a question on technical components or something like that, absolutely, we take the phone call.
Give us a number that one could use if they wanted to contact you.
Yeah, the number in the West Coast would be 949-369-7135.
7135. Now, Mike, do you take calls? Do you take questions?
Actually, I do. The problem is getting through to me because I have 17,000 square feet, 45 people working here.
Wow.
It's a city under one roof. And we have a main number of Atlanta, Georgia, of 770-676-6000. And again, I'm going to apologize up front if it's hard to get through, but I'm never really sitting at my desk when calls come through, but I always return calls this evening. So the answer is yes. I'm happy to take...
Okay, and I'm sorry, what is your last name?
Mike, his name is Mr. Mike Gramazio.
Okay.
Okay.
One more question I had. I've used the regular TENS unit like you were speaking of earlier, and I hadn't gotten I hadn't noticed too much of a result with that. But I wanted to know if you could comment on something called the cold laser. I know I've gotten help with inflammation with a trigger thumb I had a couple years ago, and it's non-existent now. But now I have trigger finger on, one of my other fingers.
All right, quickly, cold laser technology is a healing technology, right? It's not one to alleviate pain per se, but it has healing frequencies associated with it. Am I right about that?
Yes, actually, I have one in my office. It's very powerful.
So do I.
I have 28 modalities in my clinic, and they're all very high tech. But the cold laser, it depends on. It actually will help alleviate pain by moving inflammation out of the immediate area. And we've discovered electronically that 10 cycles per second will actually initiate a healing mode, and that's basically what it's used for.
Really, really low frequency stuff, huh?
Yeah.
Really low.
It has to be a whisper, cannot be shouted, and unfortunately, TENS units shout. And this is where our technology makes more sense.
Very good. Okay, by the way, for phone calls, we've been utilizing Matrix technology. If you have questions about this modality, you can give us a call here at the office. We'd love to schedule you in here and introduce you to the Matrix device, as well as trying to attempt to find the actual causes that Mike's talking about. Really is a job you should never defer and just use a device willy-nilly to get relief without knowing causes. But give us a call here, too, at 724-942-3002, where we'll try to answer your questions with respect to the Matrix. Now, coming up around the gun lap here, I got about 10 minutes left to go. A couple issues that I'd like to get to with respect to, well, you, Peter. the manufacturer. You probably know throughout the country where every single one of these devices is. If not 100%, but 99% of surety, you know where these things are available and where they're not. And with that in mind, how about my area here? As I don't find this to be that available. I find it very difficult to find. And so with my area in mind, do you have any statistics that you can just rumble through to say, well, yeah, that area out there is really that lacks a lot of these devices. What do you know about my area?
Well, beautiful part of the country, I can say that.
All right. And you do come out here frequently. You go to Cleveland, you say a lot.
Yes, I do. I actually, we have the technology at the Cleveland Clinic, as a matter of fact, in Ohio, where they've been utilizing it for a number of years. We recently actually delivered the technology over to Columbia University. So,
okay, in New York.
In New York. So as you can see, the technology is really taking hold not only by the doctors with their own practice, but also large teaching institutions. So, but to let you, yes, we do know where a lot of the physicians are who have this technology. We typically have doctors calling us up and saying, I have a patient moving from Pennsylvania to Los Angeles. Is there a doctor in Los Angeles that has this technology?
Okay.
We can do that. So, yes, we do have that. One of the things that we're going to start looking at is actually putting that list together so that way patients can go right on the internet and find a physician near them. But in your area, unfortunately, you're the only one. So
oh boy,
hopefully we start.
I thought it was a little dry, but I didn't realize it was a drought around here. Okay. Yeah. Okay. Well then, I hope better luck with that list, and hopefully this kind of a presentation will flourish and it will just grow. There's so many people in pain that they'd like to be able to find this literally in their backyard right now. But if I'm one of the few, maybe the only one in the area, it's still at least available. So give us a call here at the office. Once again, I'll mention that number, 724-942-3002. Now, I'll throw this one out to both of you because I think I've heard some answers to the question. I'd like to get your impression of it. Mike, you were the first to bring up this issue about it's good and it's bad. This matrix is so good that it can be bad because you need to go find out the causes. You mentioned the word inflammation, so here's the question. Is the device this called Matrix, which is able to get such good pain relief, only able to provide pain relief, or is there a anti-inflammatory component? Is there a correction component associated with this frequency, or is it purely for pain relief?
No, actually, that's an interesting question. The equipment was luckily, fortunately for the public, approved when it got its 510K from the FDA to apply this technology to human beings in pain. They also approved it for circulatory impairment. And what that means in English is that it actually will help remove inflammation through the interstitial tissue, or shall we say lymphatic system. Most people understand that word. And yes, it's anti-inflammatory. And not only is it pain relief, it is also increases blood flow in the area. So if you visualize that an area is now clogged with all this inflammation, sending these pain messages, shut the message off comfortably, safely. You remove the inflammation, blood flow automatically comes back to it, bringing healing nutrients. So the answer is yes, pain relief and a healing modality, but it's not approved as say, for treatment of disease, even though that's the actual definition of electrotherapy. It's musculoskeletal disorders, pain, and inflammation, and circulatory, or if you will, blood flow problems.
Well, let's say that intermittent claudication comes to mind, an arterial occlusiveness that inhibits the flow of blood to an extremity, causes pain and discomfort. Based on the pain component, I would have always expected, yeah, Matrix could be utilized here. However, too, you say that it has an indication from the FDA to use in the treatment of circulatory problems, and at the basis of this intermittent claudication is an inflammatory intravascular situation that could be benefited considerably, according to you, right?
Absolutely. I do it quite often. Intravascular, and the terminology used to define how it works. The endothelial cells that lines the vascular system is under or overfiring, causing a spastic condition. If you crimp a water hose, you're going to get less blood flow, less water flow. And that's what these endothelial cells that are responsible for the spastic movement of these blood vessels. So what the machine specifically addressed by a number of different programs is to actually cause a vasoconstriction on a minor level, fatigue those cells, shut down and shut up, stop screaming, if you will, and then you have vasodilation as an end result, or we have specific programs that are approved for vascular diseases, such as you just mentioned, because it addresses the endothelial cell directly, stops it from overfiring, gives it its a correcting mechanism, gives it the correct cycles per second, and again the body recognizes this machine as its equipment and technology, if you will, as if the body is speaking to itself intelligently. So the answer is yes, it will correct that in due time, not right away. Again, you have to find out is it diabetic neuropathy? Find out what's causing that. But in the interim, you can give relief, and it's visible, and it's permanent.
Outstanding. All right, to you, Peter. Here's another question, because I heard my buzzwords. Remember, I'm anesthesia. I'm the guy who trained to use neural blockade. They teach me in my training to inject anesthetics in the areas. Can I expect a similar response by using the matrix? If I can inhibit and prevent any nerve impulses from being generated, it seems like it's the same thing to me.
Well, interestingly enough, the last probably 4 years, we've been really focusing a lot of our attention to work with the insurance companies, as an example, educate the insurance company of what the technology is capable of doing, and really what electroanalgesia really is, in a nutshell. What we have found is that in severe neurogenic pain patients, when they're coming in with severe pain, especially like a work-related injury, they're just excruciating pain, doctors will typically go ahead, do an injection on that patient to get pain relief, hopefully to break that pain cycle, let the body start healing on its own. You also have a lot of times where there's needle trauma, where patients just does not like...
I'll tell you what, Pete, I'm interrupting you because we're right here at the gong here. They're signaling our time out of here. Let's just say this one will yet to be answered better on Friday when we talk to another anesthesiologist and get his impression. Don't you think it would be okay to bring it up then?
Absolutely.
All right, let's just say that for today, I've really enjoyed this, both Mike and Peter. Thank you so much for coming aboard. I believe we've now exposed Pittsburghers to what's happening out there in the new age front, and we'll be back with you again sometime in the near future. This is Dr. Dennis Courtney with both Mike Gramazio and Peter Beltram saying so long for AM Impact on Your Health.
AM Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.